Have you ever wondered, what if the simple act of drinking a glass of water to quench your thirst was quietly determining the fate of two of the hardest working organs in your body? Most people only pay attention to their kidney health after a problem arises. Whether it is the onset of kidney stones, an abnormal test result, or a diagnosis of chronic kidney disease, CKD. In reality, however, our kidneys work tirelessly every single moment, filtering roughly 150 liters of blood each day, maintaining electrolyte balance, regulating blood pressure, and flushing out metabolic waste. The beverages we consume have a far greater impact than we realize on whether this filtration process runs smoothly or under constant strain. Think about it carefully. How can we make choices that lead to the best possible outcomes for our health? In this overview, we will take a detailed look at 6 daily beverages: plain water, lemon water, unsweetened cranberry juice, green tea, herbal tea, and vegetable juice, and examine the biochemical mechanisms through which they support kidney health. Grounded in landmark clinical findings published in major medical journals, this evidence-based guide provides a clear scientific understanding of how every single cup you drink can make a meaningful contribution to your long-term renal well-being. Why beverage choice matters for kidney health. Before diving into each individual beverage, it helps to understand the exact mechanisms researchers measure when studying kidney-friendly drinks. In nephrology literature, 4 key mechanisms consistently emerge: filtration and dilution. The kidneys work by concentrating waste products into urine. Adequate fluid intake dilutes this urine, thereby reducing the mechanical and chemical stress exerted by concentrated solutes as they pass through nephrons, the microscopic functional units of the kidney. Reduction of oxidative stress. Due to their intense metabolic activity and abundance of mitochondria, the kidneys are exceptionally vulnerable to reactive oxygen species, ROS. Antioxidant compounds found in certain beverages can neutralize these free radicals before they inflict damage on renal tissue. Citrate binding and stone prevention. Citrate acts as a natural inhibitor of crystal formation. By binding to calcium in the urine, it prevents calcium oxalate crystals from aggregating into kidney stones, which are a leading cause of acute kidney injury and long-term renal scarring. Anti-inflammatory signaling. Chronic low-grade inflammation, often mediated through pathways such as NF-kappa B, drives the fibrosis and scarring characteristic of progressive renal disease. Certain phytochemical compounds appear to suppress these inflammatory cascades. With these foundational principles in mind, let us examine each beverage individually. 1. Plain water, the bedrock of renal filtration. Unsurprisingly, water serves as the cornerstone of kidney health, yet the underlying science is far more nuanced than the conventional advice of drink 8 glasses a day. The kidneys rely on adequate hydration to sustain glomerular filtration and prevent excessive urine concentration. When urine becomes hyperconcentrated, levels of vasopressin, antidiuretic hormone, rise. Chronically elevated vasopressin has been linked in laboratory and observational studies to increased intraglomerular pressure and accelerated renal scarring. However, interventional research challenges the simplistic notion that more is always better. The most rigorous evaluation of this question came from the CKD-WIT Chronic Kidney Disease Water Intake Trial, published by Clark et al. In JAMA in 2018. This randomized clinical trial enrolled 631 adults with stage 3 chronic kidney disease across 9 centers in Ontario, Canada. One group was coached to increase the daily water intake by approximately 1.0 to 1.5 liters above their baseline, while the control group maintained their usual intake habits. After 1 year, the coached group showed a slight reduction in plasma copeptin, a stable marker correlated with vasopressin, and minor differences in estimated glomerular filtration rate, eGFR, but these differences were not statistically significant. The authors concluded that instructing stage 3 CKD patients to boost their water consumption did not produce a clinically meaningful slowing of renal function decline over a 1-year period. This finding is critical and must not be overlooked in honest scientific writing. Subsequent research, however, helps contextualize these results within a broader framework. Large longitudinal cohort studies contributing to the fluid intake literature have identified a U-shaped relationship between urine osmolality and renal function decline. Specifically, individuals with the lowest daily fluid intake, less than approximately 0.5 liters, and those with excessively high intake, over 2 liters in populations where fluid intake is already restricted, both exhibited a higher risk of declining kidney function compared to those maintaining moderate, consistent hydration. In other words, the protective role of water appears most vital as a baseline threshold to prevent dehydration and hyperconcentrated urine, particularly in healthy kidneys or early-stage CKD, rather than functioning as a more is better mechanism that indefinitely improves renal function. The practical takeaway is clear. Consistent adequate hydration supports filtration and prevents the formation of highly concentrated, high solute urine that strains the kidneys. However, water alone cannot reverse pre-existing renal disease, and patients with advanced CKD should follow individualized fluid intake guidelines from their nephrologists rather than assuming unrestricted fluid consumption offers preventive benefits. 2. Lemon water, citrate's role in stone prevention. Lemon water occupies a special place in kidney health discussions because of one specific compound, citric acid, which the body converts into citrate. Citrate is one of the most important natural inhibitors of kidney stone formation. It binds calcium in the urinary tract, forming a soluble complex that prevents calcium from combining with oxalate to create damaging calcium oxalate stones, the most common type of kidney stone and a recognized cause of urinary obstruction and chronic renal scarring. The clinical evidence for lemon-based citrate therapy is substantial. A retrospective study published in Urology in 2007 examined 100 patients with a history of recurrent calcium oxalate stones. Researchers found that lemonade therapy increased urinary citrate by up to 203 milligrams per day and boosted urine volume by an average of 763 milliliters per day. Both changes considered protective against stone recurrence. A separate study from Duke University Medical Center, published in the Journal of Urology in 2007, followed 32 patients with low urinary citrate, hypocitraturia, who adopted long-term lemonade therapy. The stone formation rate declined significantly during treatment compared with the years before therapy began. More recently, a prospective randomized trial published in eClinical Medicine, a journal in the Lancet family, tested fresh lemon juice supplementation, 60 milliliters twice daily, against standard care in patients with recurrent calcium oxalate stones. Over 1 year, the lemon juice group had a substantially lower rate of stone recurrence with a hazard ratio of 0.43, meaning less than half the risk of the control group. Interestingly, the benefit diminished by the second year as patient adherence to the twice-daily regimen declined, a reminder that consistency matters as much as the intervention itself. Also notable is a study from the Clinical Journal of the American Society of Nephrology, which examined how different citrus juices affect urinary chemistry. It found that while orange juice can raise urinary oxalate alongside citrate, lemon juice provides a favorable citrate boost without a comparable oxalate spike. 3. Unsweetened cranberry juice, proanthocyanidins, and urinary defense. Cranberry juice's reputation for urinary health centers on a class of compounds called A-type proanthocyanidins, PACs. These molecules possess a distinctive structure that interferes with the ability of uropathogenic E. coli to adhere to the lining of the urinary tract. Because recurrent urinary tract infections, UTEs, can ascend to the kidneys and cause pyelonephritis, a condition capable of producing lasting renal scarring, preventing bacterial adhesion at the bladder level has real implications for kidney protection. The clinical trial evidence on cranberry juice presents a nuanced picture. A large randomized clinical trial published in JAMA in 2016 found that cranberry supplementation did not significantly reduce bacteriuria plus puria among elderly women in nursing homes. However, a systematic review and meta-analysis published in the Archives of Internal Medicine pooled data across multiple randomized controlled trials and found a statistically significant protective effect, particularly among women with recurrent UTIs and in populations with high adherence. The authors emphasized that the concentration of proanthocyanidins mattered considerably. Trials are using standardized higher PAC formulations yielded far more consistent benefits. This dose dependency has been echoed in subsequent double-blind randomized controlled trials comparing high-dose versus low-dose standardized PAC extracts, confirming that adequate PAC content correlates with fewer symptomatic infections over a 24-week period. The practical lesson is clear. Unsweetened cranberry juice with meaningful proanthocyanidin content helps reduce bacterial adhesion, whereas heavily diluted and sweetened cranberry drinks offer little benefit while adding an unwanted sugar load that works against overall metabolic health. 4. Green tea, EGCG, and the fight against oxidative stress. Green tea is unfermented, preserving a high concentration of catechins, plant polyphenols with potent antioxidant activity. The most abundant and extensively studied of these is epigallocatechin 3-gallate, EGCG, which accounts for up to half of green tea's total polyphenol content. The biochemical case for EGCG's renal benefit rests on its interaction with two major cellular signaling pathways. First, EGCG activates the NRF2/HO1 pathway, encouraging kidney cells to manufacture their own protective free radical neutralizing enzymes. Second, EGCG suppresses NF-kappa B signaling, a pathway central to the chronic low-grade inflammation implicated in kidney fibrosis. A review in the Journal of Translational Internal Medicine detailed how EGCG modulates these pathways to reduce renal injury in models of glomerulonephritis, ischemia-reperfusion injury, and diabetic nephropathy. Human population data adds real-world support to these findings. A cross-sectional analysis of the National Health and Nutrition Examination Survey, NHANES, published in Food Science and Nutrition in 2025, examined 5,001 American adults. The study identified a positive relationship between dietary EGCG consumption and favorable kidney function markers, including eGFR and urinary albumin to creatinine ratios. Crucially, this benefit applies to brewed green tea as a beverage, not to high-dose EGCG supplement pills. Case reports have linked concentrated green tea extract capsules to acute liver and kidney injury, highlighting that whole beverages provide antioxidants in a safe, moderate food matrix. 5. Herbal teas, gentle anti-inflammatory support. Herbal teas such as chamomile, hibiscus, nettle leaf, and dandelion root offer a caffeine-free alternative for kidney support. This is advantageous because excessive caffeine can transiently elevate blood pressure, placing additional hemodynamic stress on the glomeruli in sensitive individuals. Hibiscus tea has drawn particular scientific interest for its high concentration of anthocyanins. These antioxidant pigments have demonstrated free radical scavenging activity and have been associated with modest reductions in blood pressure across several clinical trials. Since hypertension is a primary driver of chronic kidney disease worldwide, supporting healthy blood pressure regulation indirectly reduces the mechanical strain placed on delicate renal blood vessels. Dandelion root tea has traditionally served as a mild natural diuretic, promoting urine output without severe electrolyte disturbances. While research on herbal infusions is generally less extensive than the clinical trial literature behind hydration, citrate therapy, or EGCG, these gentle beverages offer complementary anti-inflammatory and hydrating benefits when integrated into a daily routine. 6. Vegetable juices, potassium, nitrates, and vascular support. Vegetable juices, including beet, celery, carrot, and leafy green blends, introduce a unique nutritional profile. Beet juice, for instance, is exceptionally rich in dietary nitrates, which the body converts into nitric oxide to relax and dilate blood vessels. Because the kidneys depend on a dense network of microvasculature for filtration, nitrate-rich vegetable juices support healthy vascular tone and renal blood flow. However, an important caveat applies. Many vegetable juices made from spinach, beet greens, or chard are high in oxalates. For individuals with a history of calcium oxalate stones or impaired kidney function, excessive oxalate intake can increase stone risk. Renal dietitians often advise balancing high oxalate juices with adequate calcium and fluid intake to bind oxalate in the gut before it reaches the urinary system, reinforcing that beverage choices should align with individual health profiles. Summary. Across all 6 beverages, 4 recurring biochemical themes emerge. 1. Dilution reduces mechanical stress on the filtration apparatus. 2. Antioxidants, EGCG, anthocyanins, polyphenols, neutralize reactive oxygen species. 3. Citrate inhibits stone formation by binding with urinary calcium. 4. Anti-inflammatory pathways, NF-kappa B, NRF2, attenuate fibrosis driving CKD progression. No single beverage is a magic bullet, and as demonstrated by the CKDWIT trial, even simple interventions like increasing water intake must be tailored to individual renal health. Nevertheless, evidence from randomized controlled trials in journals such as JAMA and the Clinical Journal of the American Society of Nephrology confirms that mindful, consistent beverage choices provide meaningful, long-term support for healthy renal function. Closing thoughts. Your kidneys rarely complain. They do not ache at the end of a long day the way your feet or back might, and by the time noticeable symptoms appear, significant damage has often occurred in silence. This is precisely why small daily habits matter so deeply. It is not about finding dramatic overnight solutions. Rather, it is about creating a steady, protective rhythm of care. You do not need to overhaul your entire lifestyle in a single day. It can be as simple as starting your morning with a glass of water, adding a splash of fresh lemon juice to your afternoon drink, swapping out sugary soda for unsweetened cranberry juice, or unwinding in the evening with a warm cup of green or herbal tea. These small moments are gentle ways of saying thank you to two organs that work endlessly on your behalf. Treat your mind and body with gentleness and care, one sip at a time.